and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi everybody, welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. I am excited to chat with Dr. Sandhya Pattem, P-A-T-T-E-M. And she is right here in Jupiter Gardens Primary Care and Anti-Aging. The address is 175 TONEY PENNA Drive, Suite 101, Jupiter, Florida 33458. And her number is 561-746-2033. And I'm going to give your website out. It's jupitergardensprimarycare.com. Thank you so much for joining us today. I appreciate you taking time out of your busy schedule.
Thank you so much. Thank you for having me here.
Of course. I know you're quite busy. And so how is your summer going? Is it busy with a lot of patients, or are you finding people on vacation, or what do you think?
We do have a lot of seasonal patients, so it's kind of busy certain days. There's some COVID going around, some upper respiratory infections going around, so it's
right.
It goes both ways.
Yeah.
Some days are busy, some days are not
Sure.
as busy. Yes.
Sure. I find it so interesting and convenient that you do primary care and anti-aging.
Yes.
Right? And why not? Because if I'm at the doctor, I would want to know what can I do for these wrinkles or what we have going on here. So maybe tell us a little bit more about what kind of patients you see, and once they turn into anti-aging patients, what type of procedures do they do?
I think the patient never just turns into anti-aging. So we do both primary care and anti-aging services that we offer
Okay.
at the clinic. I am doing mostly above 18, except a few kids with a family medicine background.
Okay.
I don't do vaccinations, and that has been the primary reason as to why I haven't been accepting kids. But I'm still very comfortable taking kids above 16, 17 once they've completed the vaccinations. So we cater to all age ranges in the office. And when patients find out that we do anti-aging in the office, they kind of like are inquiring as to what we're doing in the office. And I do some Botox, fillers, medical weight loss, bioidentical hormone replacement, supplements, nutritional advice, and such in the office, along with the primary care. Primary care is the main stream practice.
Dr. Pattem, I'm going to give our 800 number. If anybody's listening today, I would love for them to call in and ask you a question about your services that you offer. Our phone number is 888-994-4995, Studio A as in Apple. I know that there's a lot of people listening right now, and maybe they're wondering, okay, medical weight loss, I've been hearing stuff, I don't know, is it good, is it not good? Because we have a lot of different conflicting information. So maybe you can help us kind of break it down. Who gets these types of medical weight loss medications? What are they, and how can they benefit us?
So there are a lot of categories of medications that have been available traditionally for weight loss. A lot of these are FDA approved. I think before we started hearing about the Wegovy, the semaglutide, the tirzepatide, and the Mounjaro, we had other oral medication options like phentermine, Adipex, Contrav, Cusimia, and other combinations, which are, yes.
There's a lot. I didn't
Right.
realize that.
Right. But I think once they found out that these anti-diabetic medications are helping a lot with weight loss, they actually have gotten a huge momentum, and they're very effective in weight loss as well.
So does it suppress your appetite? Does it do something to your brain chemistry? Like, how does it work metabolically in our body?
So these medications are known popularly as incretins. They're also called GLP-1 receptor agonists.
Okay.
So they are very similar to a molecule that your body produces, which suppresses appetite,
Okay.
which decreases your gut movements, which slows down your gut movements. And so the side effects that happen because of how the mechanism works makes you feel full all the time, have a reduced appetite, you don't feel hungry, and you feel full, and that's basically how people are able to stop their cravings and not eat as much because they feel full all the time. And that's because the stomach movements are slowed down. It's called delayed gastric emptying.
Okay. So anybody listening, if you have any questions, please call in, ask Dr. Pattem, 888-994-4995, Studio A. So I heard actually somebody on social media saying she took I don't know if it was Ozempic or semaglutide, but she said her anxiety went away. I don't know if that was a coincidence, but somebody was saying how it helped her with other things that it benefited her. So are those some of the side effects?
I think anxiety going away, I don't know if it can be turned as a side effect. It probably will be reaped as a benefit, probably.
A benefit, that's what I meant,
Right.
yes.
So there are a lot of non-FDA indicated indications that you're able to use the medication for. So, which we've known recently that it's helping with inflammation in the body. And it's helping with some autoimmune conditions which can cause inflammation indirectly.
Right.
Which can be a cause for anxiety in patients. So
it's all
you know,
like trickle down effect.
Yes, and there is also an indication for improving cardiovascular outcomes for semaglutide and for liraglutide, dulaglutide, some of the other medications. I think tirzepatide probably also will have those, but I think research is still underway.
Interesting. And so is it given in a pill form? Is it an injection, or how does that work?
So it's a good question. It's a sub-Q injection. It's very easy to administer. You can do it at home yourself, and it's once a week, so it makes it a little more easier.
Okay.
And people are seeing extreme benefits of weight loss, very profound.
Yes, I've heard that. I see it everywhere now.
It's there everywhere.
So what is the difference between, let's say, semaglutide, Ozempic, and all the different ones? Are they all the same, or variations, or how does that work?
That's a good question. So initially the GLP-1 analogs, which is semaglutide, came out as a diabetic medication.
Okay.
So indication was only for diabetes. And then we were noticing a lot of weight loss. And then FDA got it approved for weight loss. So the company that manufactures semaglutide as Ozempic for diabetes indication and as Wegovy for weight loss, but it's absolutely the same molecule.
I see.
And the same thing with Mounjaro. Mounjaro is for diabetes, and Zepbound is for weight loss.
Interesting. Now, what about people trying to get it? Like, I've heard maybe people are trying to get it online, or they're trying, like, what's going on with this? Is that, please share with us how that works.
So it's available even in compounding pharmacies, and that's likely what people are getting online. So I would do my homework, make sure that I would talk with a provider, a licensed medical practitioner, a physician or a nurse practitioner or a physician assistant, or somebody who's licensed to practice medicine before you get the medication from online, rather than just like going online, you know, some website is selling it and paying and getting it off, because there's a lot of confusion. I have a lot of patients coming to my office and said that they're taking 50 units, but they don't really know the milligram dosage.
I was going to ask you, don't they have to see a physician to know the milligram dosage of how much to take?
Right, so this is what I'm seeing a lot outside when people are getting it from other, yes, it's concerning. So I would urge patients to understand what milligram dosage they're taking. Because the units can actually vary very widely because it depends on the dilution of the medicine.
Ah,
So
interesting.
10 units could be 0.5 milligrams, 10 units could be 1 milligram. So, so units will not really make any sense. So I would urge patients to understand what they're taking, what they're putting in their bodies, where they're getting the medication from. Is it a legit source that they're getting medication from?
Course.
Right.
Yeah. So now, as somebody reaches their goal weight, how does that work as far as like weaning them off? Do you lower the dosage, or how does that work?
So the different options, and I think medicines are very expensive, so I think cost is an issue. So there is no indication to get off the medication, especially if you're a diabetic,
All right.
because there is
Sure.
a huge improvement in the glycemic status. The hemoglobin A1C, which we go by for diabetes control, there is a huge improvement. It falls by 2, 3, and I've actually seen extreme improvement. I've seen patients actually go from 11 point something to even 5.5
So
in about 3 to 4 months.
that's amazing. Can you break down what is the A1C? Because I've heard it a lot, and I'm sure people are listening. And if you can refresh our memories, what exactly is the A1C test?
So hemoglobin A1C is a lab test that we often do to diagnose diabetes
Okay.
and also to assess the control of diabetes. So anything above 6.5 or above will qualify you for being a diabetic. Once
Wow.
you're a diabetic, you're always a diabetic.
So now it goes back a certain amount of months where it's able to see
Yes.
that range. Is that also
So hemoglobin A1C talks about your glycemic control over an average of 3 months.
Isn't that
So
amazing?
it tells you
how
about
it
like
can
how
do-
your sugars have been controlled over the last 3 months or how high they were.
Wow.
So yes.
That is fascinating. I'm sure there's a lot of people that are even pre-diabetic and maybe they wouldn't even necessarily know it. I mean,
We do the tests. I would not really say that everybody out there, all the medical practitioners are doing a pre-diabetes test, but sometimes insurance covers and sometimes they don't cover it. But if you do actually have a higher fasting sugar, or if there's any other indication, or if you have any symptoms of diabetes like being thirsty all the time, you're going to the bathroom more frequently, you're losing weight and things like that,
Yes.
there's an indication you can do the test.
yeah.
And yes, so pre-diabetes is a hemoglobin A1C from 5.7 to 6.4. And
Wow.
once you hit 6.5, you're a diabetic. 6.5 and above.
Now,
So-
you said once a diabetic, always a diabetic? Because I
Yes.
had gestational diabetes when I was pregnant. What does that mean? Does that mean that I would be
So-
at risk when I'm older?
Gestational diabetes, yes, you can be at risk when you're older to be a
Right.
frank diabetic, but not all gestational diabetes are diabetics immediately after they give
Right.
childbirth.
Yeah.
So it
No,
can
it went
take a
away.
few years and yes, before they turn a diabetic, but the risk is always there.
Yeah. No, it's so important. So talk to me about what other anti-aging things that you do at the clinic. I know you said you do Botox, right?
We do Botox. I do bioidentical hormone replacement. We do fillers. I do some supplements in the office, and the big treatments that we do at the office, which go into the anti-aging category, are the medical weight loss and the bioidentical hormone replacements.
I will tell you, I've been on bioidenticals for years, and anybody who's listening out there, it has changed my life.
And I hear that all the time.
I would never go
Yes.
back.
We never go back. Not
I'd never
taking
go back
those.
to not
Yes.
taking them.
Well, I have 70-year-olds, 80-year-olds, they don't want to come off the medications, the hormones, because they just feel so good. And I
Yeah.
think the biggest thing that I'm also seeing in the population that's taking the bioidenticals are they don't have osteoporosis incidence as much. That I see so much in people otherwise who are not. So menopause is a big risk factor when you don't really have the estrogens and the normal hormones that you need to have. Your bone loss goes down, your bone density goes down, your fracture risk goes up. But in my population that are on bioidentical hormones, I don't see that as much.
We're going to take a quick commercial break, but I want to continue this bioidentical conversation when we come right back.
Sure.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks everybody for tuning back in. I am your host, Louise Gomez, and we have Dr. Pattem here. And she's right here in Jupiter. She is, the website is jupitergardensprimarycare.com, and the address is 175 Tony Penna Drive, Suite 101, Jupiter, Florida, 33458. And Dr. Pattem, I am loving this conversation about bioidentical hormones. And the weight loss as well. But the bioidenticals for me, I had severe migraines and I didn't know what it was until I went to the right doctor and she told me. So what type of blood work, like give us an instance, like what kind of blood work do you do and how that all works? If you could break that down.
Sure. On average, I think most women start experiencing some symptoms, and it varies with time and age, and we typically behave how like our mothers have behaved. What age that they went into menopause is basically the average age where we also go into menopause as their daughters.
Yes.
And it also is the same with menarche as to when they hit their periods and stuff like that. We all show some decrease in hormones right from late 20s, late 30s. Some people, late 30s, I would say.
But it's so slow.
Very slow.
And then it creeps up on you. And
it does.
And then 40-something.
Early 40s to late 50s, 40s, I think a lot of people experience migraines, insomnia, sleep quality is hindered. They're not really able to lose weight as much, anxiety, mood changes, hot flashes, dryness of the private areas, decrease in interest for sex, decreased libido, all of these are part of the changes that we dismiss as traditional medical providers. But these are all because of the menopausal changes. There was a study that came out in 2003 called Women's Health Initiative, which primarily checked with the Premarin and the synthetic hormones out there.
Synthetic hormones.
Exactly.
Right. I'm glad you're talking about this study. Go ahead.
Right. And the risk factors were so high that they had to shut the study down abruptly because there were increased incidence of cardiovascular risk factors and increased incidence of cancers.
Right.
But this study is known to have done a lot of injustice to a lot of women out there.
That's right.
Who could potentially have used the bioidentical hormones.
That's right.
Very early on to help with all these symptoms.
Thank you for addressing that, because so many women hear hormones and they get scared. That study was synthetic hormones, and bioidentical, the constituents are very different. Can you speak about into the constituents of what they're made out of?
So most of them are plant derived. Mostly they derive either from soy based or yucca, I guess, and they are from plants.
Yes.
And they're very similar molecules that your body naturally produces. And the biggest difference that I've learned that I didn't realize and I didn't really get answers from, even when I was trying to look into how to do when I was trying to get my questions answered. So I went for different conferences. I learned. I did a lot of. I've heard a lot of podcasts.
Sure.
And did a lot of reading, and I still didn't get those questions answered. So I think, interestingly enough, when I went to a conference, I asked the teacher was saying that despite taking bioidentical hormones, it does not offer birth control protection. You still will have to need a birth control protection in addition to bioidentical hormones if you're taking bioidentical hormones or if you don't want to come off those. I said, why is that? Because you're giving hormones, and why do you need an additional protection? So, and that's basically when I started understanding that these are targeted more towards what your body naturally produces, and not to supersede, not to take over your body's natural cycles. When we do OCPs or birth control, we take over the body's cycles.
Oh, we have a caller actually. Let's. I'm sorry to interrupt you. Thank you for calling in. Do you have a question for Dr. Pattem?
Yes. My name is James, and I'm calling on behalf of a female loved one. I have a specific question in regards to hormones.
Yes.
So, my loved one is, in her 40s now, and she's concerned that her hormones may be triggering, weight gain and other things like loss of energy and sleeplessness at times. What do you recommend, and how would you go about treating that, doctor?
Yes, sir. All of these are very typical of low hormones or perimenopausal symptoms. People can still continue to have regular cycles, but still can have less hormones. So we gradually decrease production in the body, which can lead to all these symptoms. I hear this all the time, very similar symptoms, inability to lose weight, not able to sleep well, migraine headaches, anxiety, all of these. So what I would suggest is look for a provider or a doctor that's able to do bioidentical hormone replacement therapy in your area. You need baseline blood work, and then they will come up with a customized formula for you, and that will be the route that I would take. There are different options. You can go by creams. There's something called troches. There's a pellet formulation, and the provider will be the best person to advise you on that, depending on your hormone levels and depending on what works or suits best for you.
Now, typically, doctor, how are the hormones taken? Is it like in a pill form, or is it through a shot?
Okay. So, yes, there are different options. They're pill form also. There's a cream formulation. There is something called a lozenge or a troche that you put in your mouth. It dissolves over time, over about like 15, 20 minutes. And injectables for males, typically, and they also can take lozenges and troches.
Okay. All right. And you're finding that even women, say in their early 40s, could possibly be premenopausal?
Yes, it depends on their hormone levels, and I would actually go by testing them first and coming up with a custom formulation. Sometimes we do a different dose for the first 14 days of cycle, and then we can do a different formulation for the latter part of the cycle, depending on their hormone levels, depending on their cycle status, if they still have their periods and all of that. There are many factors that go into it before we come up with a solution for them.
Thank you. Thank you very much for that information. That's valuable. I appreciate that, Dr. Pattem.
You're welcome, and thank you for calling in.
So that was great. We had a caller. I love it. So there are people out there listening, and they know that they have their loved ones that are experiencing this. And I'm so glad that people are, open to learning about it and doing something. So thank you so much, Dr. Pattem. We actually have like 1 minute left. Do you want to at least, give us some closure on this conversation?
Okay, I want to touch on medical weight loss. So go to a legit provider. definitely have a consultation with them before you actually consider medications.
Yes.
Weigh the options, look at the side effects, get some blood work done if needed.
Thank you.
See if insurance can cover the medication. If you're diabetic, your insurance can cover the medication. It might need prior authorization sometimes. And muscle mass is a big side effect. Make sure you're getting adequate protein intake. Stay hydrated.
Yes.
A lot of resistance training that you need to keep up with the muscle mass when you're taking medical weight loss
True.
medications, because they could be profound weight loss, and
Yeah.
all of that is not fat loss. You have
Yeah.
a lot of muscle mass losing too.
Wow.
With hormones, again, the same. Get a baseline, know your options, go to somebody who's been doing this for a while, and stay healthy. Exercise, eat well, drink a lot of water, take your supplements, and
Thank you so much.
thank you for having me here.
I appreciate it. Everybody who's listening, please see Dr. Pattem. She's right here in Jupiter. She is, look at her website, jupitergardensprimarycare.com, and you can call them 561-746-2033. Thank you so much for joining us today. It was a delightful conversation.
My pleasure. Thank you so much.
Absolutely. Wonderful.
Thank you for letting us share with you a longer and healthier life.